Got back pain shooting down your leg? Or maybe your neck feels like it's sending lightning into your arm. Today, I'm going to break down exactly what a herniated disc is without the medical jargon. So grab a seat, maybe a seat cushion, because we're going to be talking about your spine's built-in shock absorbers, the disc, and what happens when they blow out. Let's start with how your spine is built first. You've got vertebra. Those are the bones that are stacked like building blocks. And between them sits your discs. Picture jelly donuts. The disc is made of a jelly-like center surrounded by tough fibers. Behind the disc runs your spinal cord. And at each level, nerve roots exit through openings called foramina. These nerve roots power your muscles and carry sensations from your skin all the way up to the brain. When everything's aligned and healthy, your nerves have plenty of room. So what happens when things go sideways? Sometimes the disc weakens or tear, and the jelly inside pushes out. A bulging disc means the outer layer stretches but doesn't tear completely. Think of squeezing a hamburger that's a little too big for the bun. It sticks out. A herniated disc is when the gel breaks through tough fibers. There's usually two types or two ways it can cause pain. First, research done by Nikolai Bogduk has shown that discs contain nerve fibers, and when the disc tears or swells, it irritates these tiny nerves inside the disc itself. Imagine a paper cut inside your spine. It doesn't look dramatic, but it hurts a lot. Second way to have pain is the protruding material, the jelly, compresses nearby nerve roots. Think of stepping on a garden hose. The water flow stops, or in this case, the nerve signals get blocked or irritated. So the nerves are compressed by a herniated disc. That's the second way that we talked about. That's what causes the numbness, tingling, weakness down your arm or leg. When a nerve root gets compressed, it can cause shooting pain along the nerve's path, similar to what people complain about sciatica, that pain that goes down your butt all the way down your leg. Also numbness, tingling, and muscle weakness as well. Loss of reflexes. That's when the doctor checks with the little reflex hammer. Those can be diminished. Severe unrelenting pain that doesn't improve with rest as well. In the neck, a large herniation can cause direct pressure on the spinal cord itself. This can cause more serious problems called cervical myelopathy. Common symptoms include trouble with balance or walking, loss of coordination, difficulty using your hands, you might find you're clumsy, weakness in both your arms and legs, difficulty with fine motor skills like buttoning your shirt or writing. That's why any new issues with walking or hand function should get checked right away. Call a doctor immediately if you experience any of the following: loss of bladder or bowel control, severe weakness in a leg or having foot drop, numbness around the groin or saddle area, severe constant pain never eases up and you can't find relief in any position you're in. Like I said before, weakness in your hands. These are red flags that need to be evaluated immediately. It's important to know the only way to accurately diagnose a herniated disc is with an MRI. Sometimes CT scans can pick up a herniated disc, but their MRI are really the gold standard. X-rays don't show the soft tissues inside your disc. So what causes herniated discs in the first place? Here are the usual suspects: trauma like falls, car accidents, or sports injuries, repetitive strain from bending over and over again, lifting improperly over and over again, poor posture, especially slouching over at the computer for hours doing work or watching YouTube videos, bad lifting techniques like trying to deadlift your couch alone, and of course, aging. Aging affects the disc by drying them out. The discs lose water content as we age, and they become more brittle, and they're more susceptible to cracks and tears. The good news is most herniated discs don't need surgery. There are plenty of treatments, chiropractic care, physical therapy, exercise, and medications that can help you recover. Many people improve within a few weeks or months without invasive procedures. The most important thing is to see a qualified healthcare professional to get the right diagnosis and plan. Self-diagnosing based on YouTube videos is never advisable and never enough. YouTube videos like this are good to understand more about how your body works and help you make better decisions. If you found this helpful, check out my playlist on herniated discs and disc recovery and safe exercises. Drop a comment below with your questions. I respond personally. And subscribe if you want no fluff videos that help you stay strong and pain-free.